Good morning, good afternoon, good evening. Welcome to the next podcast brought to you by PM Powered, your consulting firm for project, program, and portfolio needs. I'm Wanda Curley, your authority on project, program, and portfolio needs. And without further ado, let's get started. Last week, I talked about some NGOs, non-governmental organizations, and other organizations that go out and try to do good for the world. Today, I'm going to focus on WHO, the World Health Organization, and some of the projects they're doing. And I want to look at them in a little bit more detail to not say that these in particular have failed, but to understand why many of these projects that these organizations do fail. And it's for various reasons, but let's look at these in particular. So the first one I'm going to talk about is called Building Resilience of Health Systems in Pacific Island LDCs to Climate Change. So just to read a little bit about what it's about, and I'm not going to read the whole thing, but this project will support the 4 Pacific least developed countries, which is Kiribati, Tuvalu, and Solomon Islands, and Vanuatu, to enhance the capacity of national and local health system institutions, personnel, and local communities to manage health risks induced by climate change. So the goal of this project, and we always have to have goals in projects, and that is a good thing to have. So the goal of the project is to enhance the capacity of national and local health system institutions, personnel, and local communities to manage health risks induced by climate variability and change in 4 Pacific LDCs, and that was Kiribati, Solomon Islands, Tuvalu, and Vanuatu. This goal will be achieved through on-the-ground interventions and policy-level actions under 4 outcomes as described below. So the project is supposed to have 4 outcomes. So let's read what the outcomes are, and we should have those on projects, but many times we don't know what the outcomes are on the project. We just write the statement of work, and then based on that, that's the outcomes. But we really should designate what the outcomes should be on our project so we know what the end state looks like. So therefore, outcomes are outcome number 1, governance of health systems and institutional capacity strengthened by mainstreaming climate-related risk and resilience aspects into health policy frameworks. To me, that's a little bit lofty. It doesn't really tell me exactly what I want to hear. So it goes on to explain it that this project will support healthcare institutions and health personnel to have the capacity to fully integrate climate risk and resilience considerations into national and subnational policies, plans, and regulations and cross-sectoral coordination mechanisms related to healthcare. Again, a little lofty, but it goes down into a little bit more detail to make it more credible. So outcome 2 is capacities of health system institutions and personnel strengthened in managing health information and weather, climate, early warning systems. So that's a little bit better to understand, and I'm not going to read the sub areas that they have because that goes on for 3 paragraphs. Outcome 3, improved coverage and quality of health services addressing climate-sensitive diseases and reduce climate-induced disruptions in the function of healthcare facilities. Again, it goes on for 3 long paragraphs. If you can't state it in 1 or 2 sentences and truly understand what it means, then I think the outcome needs to be looked at in more detail. Outcome 4, enhanced cooperation between countries to foster knowledge exchange, the provision of technical assistance and scientific advisory, and the integration of national health policy frames and related adaptation plans. That's a good one. That one I understand what it means, and there's no need to go into a lot more detail, but they do have 2 long paragraphs on that. But they're explaining who's involved with it. So who are the partners on this one? This project will be funded by the Global Environmental Facility Least Developed Countries Fund, with co-financing from the 4 LDC national governments, WHO and UNDP. Who is the implementing agency for this project in cooperation with the Ministries of Health and Medical Services? To me, that's one of the big flaws in this project, and a lot of flaws where WHO or UN or World Trade Organizations are involved, is that you have a lot of big hitters in there. So we've got the WHO that's putting in money. They are the implementing agency for this project, so that leads me to believe that they're supposed to be leading the project. But you also have the countries involved, and the countries involved want to have a say in this, but it's the government. It's not the end users on this, unless you consider the government as the end users. So who's really driving this project? And we have, so the LDC national governments are in there, so they're doing some co-financing. The Ministries of Health and Medical Services, WHO, and the LDC national governments and UNDP, so the UN is also doing it. So all of these organizations are probably putting in a vast amount of money. So all of them will want to make sure as sponsors, and it's terrible when you have more than one sponsor on on a project, because who is the overriding sponsor? If you have the sponsors' wants and needs that are going in different directions, then how do you as the project manager resolve that? It takes an understanding of how people think and how people do integrated reasoning. And through this, the project manager finds out a better way of doing it. The project manager also has to understand the political climate, because if the project manager doesn't understand the political climate, then the project is doomed to failure. And I'm going to venture to guess that unless that is brought into consideration quickly and it's understood who the overall sponsor is, that the project will fail or will not be as successful as it could be. So let's go to the next one. Again, it's another WHO, so World Health Organization, and it also has to do with climate change and human health. This one is the Global Framework for Climate Services. It's called the GFCS Adaptation Program in Africa. So this one has to do in Africa, whereas the other one had to do with Pacific Islands. So this new program will help to guide decision makers and public health authorities to provide well-targeted climate services in countries in Africa through operationalizing the GFCS to obtain accessible and accurate climate service information. So let's go into a little bit of the problem of this and the problem that they're trying to resolve, and then I'll get into the project. Currently, an estimated 70 nations have inadequate or no climate services and remain ill-equipped to tackle any climate variability. Africa maintains the continent most vulnerable to the impacts of climate change and faces increasing repercussions to food security, nutrition, water supplies, socioeconomic development due to the impact of human-induced climate change to climate variability. Okay, so what is the goal of this project? The goal of the program, and I'm glad to hear it's called a program, although I think they're using project and program interchangeably, because even on the one for the Pacific Islands, it was more of a program as defined by PMI, the Project Management Institute, rather than project. There were several countries involved, so each country in itself is a project. So let's get back to the Africa one. The goal of the program is to increase the resilience of people most vulnerable to the impacts of weather and climate-related events through the development, implementation, and evaluation of joint program of climate services in program countries. The program is helping build integrated frameworks within countries and supporting existing initiatives in climate services, food security, nutrition, and health, as well as disaster risk reduction. The project. So what is the project? The project was governed by a prime grant agreement signed between the World Meteorological Organization and the Norwegian Ministry of Foreign Affairs for a multi-agency global framework for climate service adaptation 3 years from 2014 through 2016 with a total budget of 10 million US dollars. The focus for this program are Tanzania and Malawi. The program also has a component in food security and nutrition in Ethiopia. So you have already 3 countries involved. This cannot be one project. This has got to be 3 different projects. And if not, I would even venture to guess that it should be even more than 3 projects, because even the country has several projects within it, which could then roll up to a program, which then rolls up into another program. So you could have programs rolling up into programs. So you can see how complex this could be. Or you could have all the projects within the countries rolling up into an overall program manager. But if I were running it, if I were the overall program manager, I would have each country bring a program. So there would be several projects underneath it and then rolling up onto this. This helps contain the sponsors so that the projects within the countries and the programs within the countries aren't really dealing with the sponsors. And the sponsors are the World Meteorological Organization and the Norwegian Ministry of Foreign Affairs for a multi-agency global framework for climate service adaptation. So that would be dealt at the overall program level, will be dealing with these sponsors, which minimizes the risk, again, to the projects going on in the different countries. So at a national level, the project aims are to do the following: engage in institutional anchorage of programs at the highest possible level to bring together various existing platforms. Again, this is a little bit lofty. It really doesn't put concretely what needs to be done. The second one is to improve capacity of national actors to tailor, deliver, and evaluate climate services to support adaptations in Malawi and Tanzania. That one's a little bit better. I sort of understand that one. Improve the ability of production centers to respond to user demands of climate services. Again, it would be better if they understood what user demands are. Are those the people in the countries, or are those government agencies within the countries? What is user demand? Improve the awareness of climate-related risk in each sector: agricultural, health, and DRR. And excuse me, I don't know what DRR is. And improve capacity of sectors to address these risks. Again, that's a little lofty, but a little bit more understood. Integrate climate service priorities with national adaptation plans in Malawi and Tanzania in order to improve climate change adaptation. Improve early warning systems for food security, health, with the use of climate services. And so that's at the national level. So we go down, even down to the local level. The project aims to identify household climate service gaps and outstanding needs to drive service designs. That's understandable, but I would hopefully they would bring in the end users, and those are the people that are living in these households. Strengthen capacity of communities and local institutions to transform climate information into action, and improve capacity of households and communities to demand and use climate services for improving management of climate risks at a household level. Organizational change is hard, even within a company. So can you imagine doing it at a country level, even down at the local level? That is going to be very difficult and will take more than 3 years to implement, and this was only a 3-year project. At a regional level, the project aims to improve learning within the international community of practitioners on provisions of climate services to end users. So this is at a regional level, they're training people to help the local services, improve coordination and exploit synergies of climate change adaptation programs in the targeted regions. So activities to enhance health resilience include reviewing and improving early warning systems for health, defining clear roles and responsibilities of the health sectors in relation to others during extreme weather events, building capacity of health professionals to manage health risks for climate variability and change, and ensuring that climate services are appropriately integrated into national health and environmental policy and programs. So you can see how complex this has been, and they call it a project, although they use interchangeably program. This needs to be rolled up into a program because it's too complex to run as projects. Project managers can't understand what is being driven by this. They need to have statement of works that are very detailed and oriented. There needs to be a lot of planning, and 3 years is not enough time to run a program of this sort. This is a 10 to 15-year program. So already you can see that it's somewhat doomed to failure. Again, I don't know if this project, as they call it, was successful or not. It was 3 years. I tried to find it and couldn't find anything. I will continue to do that. And if I do find it, I will let you know. But let's get into the partners involved. So you're going to be amazed at the partners involved. The program focuses on partnership approach involving 7 different international agencies and research institutions. The partners for this organization, WHO project, or actually it's a program within a program, are the World Meteorological Organization, the World Health Organization, the World Food Program, the International Federation of Red Cross and Red Crescent Societies, including the Norwegian Red Cross and Red Cross Red Crescent Climate Center, the CGIAR Research Program on Climate Change, Agriculture and Food Security, which is the CCARAFS, and the Center for International Climate Environmental Research, Oslo, the CICERO, and the CHR Michelin Institute. I think CHR, I'm not sure exactly what that stands for, but for the Michelson Institute. Now you have, I have some background in international development projects and programs, not extensive, but some. And when you have all these organizations coming together, neither one of them wants to succeed to the other one. So they all want to be co-partners in this. And projects are doomed and programs are doomed to failure if you have them co-partnering through this. One organization needs to lead the others so that you have a coherent thing that goes well. For example, the World Food Program may do well in logistics, so let them do the logistics. Whereas the International Federation of Red Cross may do very well at the project management, so let them do the project management and the overall project management. But anyway, that is one of the things that may doom this to failure, is having so many partners instead of having one in charge. Then the future, the program, and I'm glad to hear that they said program. This program is initially benefiting 2 developing African countries subjected to multiple climate-sensitive threats. Detailed activity planning at a country level for Tanzania and Malawi began in February 2014. These activities will continue to build upon existing services in food security and nutrition and health and disaster risk reduction within each country. Again, with these 2 projects that I have gone over, you saw that there were multiple partners, and yet one wasn't named to be the overall arching project program lead. Another thing that might doom these to failure, and again, I'm going to try to find out if they were successful or not, is that they're not running them as programs. They're running them as projects, individual projects, but there's nobody seeing the overarching need and synergies that there are between projects and whether one project needs to go faster or slower than others. And as a program manager, you would be able to see this because you're looking at the milestones. You understand all of the different goals for the different projects, and you bring it up into the program level. This sometimes can create some tensions because sometimes the program manager will tell a project to slow down or speed up. And that's not what the project manager wants to hear, because the project manager is wanting to get their project done within the triangle. So the triangle, which is budget, time, and variables or scope. So you see that with project managers that there's this tension with program managers. But overall, the program manager has to run it as a program. And these need to all be run as program. So I hope you found some of these 2 WHO projects interesting. And as I mentioned before, I will try to find out if they were successful or not. This podcast has been brought to you by PM Powered. your consulting company on project, program, and portfolio needs. I'm Wanda Curley, your authority on project and program and portfolio items. Please please connect with me on PM Current. You can connect to my YouTube, my LinkedIn, my Twitter, and my Facebook account. I'm Wanda Curley, and please contact me if you were the project manager on any one of these projects, or the program manager if it was run as a program, because I'd love to hear how international development projects and programs are run in more detail and what the successes and failures were on your project. You can contact me at wanda@pmpower.com. Have a wonderful week, and I look forward to seeing and hearing from you. Take care.